Hello and welcome to today's webinar. My name is Kate Talbert, Director of Reporting and Analytics with CRISP Shared Services. And today we're going to share information about an enhancement to CRISP's multi-payer reporting suite, the new Quality Reporting Dashboard. I'm joined by my colleague, Audrey Speeder, Director of Healthcare Policy at HMetrics, who will demonstrate the dashboard. Next slide. For today's agenda, I'll provide an introduction to the reporting suite and why the new quality reporting dashboard was developed, and then I'll turn it over to Audrey to discuss the list of measures and show a demonstration. Next slide. Working in collaboration with key stakeholders in Maryland, CRISP identified a need for additional reporting on quality performance measures to drive quality improvement for primary care, Medicaid, and other healthcare organizations. The multi-payer reporting suite was identified as a good location for these reports because the suite is the only report in CRS that uses both Medicare and Medicaid claims together. It is also made available to any Maryland healthcare organization that sends a panel of patients to CRISP. CRISP and HMetrics have worked over the last year to understand what quality metrics were most relevant to Maryland stakeholders, including MCOs and Maryland primary care practices, and came up with this initial list. I'll turn it over to Audrey now to talk about the measures and share a demonstration.
Thank you so much, Kate. Hi, everybody. This is Audrey Speeder with HMetrics. I want to cover with you briefly just a summary of the quality measures that we're including in our new quality measure dashboard. The 14 quality measures that we include are based on two different measure types and two different units of measure. So we first include rate-based measures, and those are those are measures that are quantifying the rate of performance, as opposed to count-based measures that are simply counts of events that happened within the population. Those measures are arrayed on two different dimensions, one being a unit of measure as the beneficiary, where we are looking at the entire beneficiary as a whole and looking at the performance for a given measure. So for example, the HbA1c poor control for patients with diabetes measure is looking at the patient overall and seeing if that beneficiary or that patient has had their HbA1c controlled or not. For measures in this domain, we are showing results over a rolling 12-month period, and we are not enabling the user to look at a specific time period. It'll always be fixed over the most recent 12 months. That's different from the event-based measures, which are shown on the bottom of the screen, where the unit of measure is an individual event. So this enables users to look over a specific time period to look at, for example, the follow-up after emergency department visits for alcohol or other drug abuse or dependence. So it's identifying emergency department visits in a specific time period and whether or not the beneficiaries have received appropriate follow-up. So these do have a custom time filter. You're able to look at a period of time of interest to you and look at the performance over that period. That covers both the rate-based measures as well as the count-based measures. So as we turn to the quality measure dashboard, this is just a quick screenshot of the landing page. I'm going to jump over and show you a live demonstration in just a second. The quality measure dashboard can be found within the multi-payer reporting suite. All the way at the bottom of the left panel, you will see that quality measure dashboard. It'll include this landing page as well as drill throughs to get to each of the individual measure reports. So now let's switch over to our demonstration. Okay, on my screen now, you should be able to see the full landing page in our demo site. Just as a disclaimer, this is using a demonstration data set. There is no PHI shown. We will be looking at beneficiary level information. It is all masked to protect PHI of patients. So as I mentioned, the quality measure dashboard is accessible on the left toolbar of your screen, and that will take you to this landing page. The landing page is organized within the three different domains that we talked about. So you first have your rate-based beneficiary level measures. You then have your rate-based event measures and your count-based measures. For the bottom two measure types, you have the date scroll bar here that allows you to customize the period you're looking at. By just changing this date, all of the reports and all of the measures will be updated. The report also contains a comparison group. So our rate-based beneficiary level measures and our rate-based event measures do have comparison populations for your simple comparison. You do have the opportunity of looking at a Medicare or a Medicaid population as your comparison. For purpose of the demonstration today, I am focusing my population on my Medicaid panel or the Medicaid beneficiaries within my demo panel, and I will be using the Medicaid comparison group for an apples to apples comparison there. So our report is this landing page consists of all of these various different widgets. Each of these is an individual link into a drill through report. The reports are structured within three primary views, and I'm going to review each of those views with you today. All of the rate-based measures look about the same as the event-based measures and same as the count measures. So starting with rate-based measures, I'm going to start with my asthma medication ratio measure. In this report, in all of our measures, we do start with an introduction on what the measure is and what the specifications are. We have a quick one sentence or so to define what the measure is and to define how performance is defined, as well as a little information button where you can get more details about those measure specifications. Again, you're also able to change your comparison group within each of the reports. So to get started, I want to draw our attention to the right side of the screen here. This is your overall measure performance for the population of interest. So for my AMR measure, for my panel of Medicaid beneficiaries, we have 96.2% performance for this measure compared to the comparison group of Medicaid, which is 60.7%. If you are interested in understanding who are the beneficiaries that comprise this measure, if you click on the bar, you're able to access two beneficiary drill throughs. The first one is a list of beneficiaries who did not meet the measure. So that is those beneficiaries who are eligible for this measure. So those beneficiaries that are 15 to 64 years old who have been identified with persistent asthma. It's the beneficiaries who did not meet the measure. So they did not have the AMR ratio greater than 0.5. Or you can see the list of beneficiaries who do meet the measure. So I'm going to go ahead and click on the list of beneficiaries that do not meet the measure, because from a care management perspective, this is the population that you might be able to provide additional care management for, or you'll be able to operationalize and potentially reach out to those beneficiaries to help assist them. So this takes you to your population navigator view. This is the list of the 13 beneficiaries that did not meet the measure according to the specifications. And you have the opportunity here to drill through or to highlight a subpopulation based on chronic conditions by using your measure bar on the right. Or you can do any additional filtering by age, gender, date of birth, race, any other demographic category by using your population navigator functionality. When you're done, you're able to create rosters and then apply those rosters elsewhere into other reports across the reporting suite. Okay, back to our AMR report. So that's giving us the overall population and who has met and who has not met the measure. We also have this large chart that is showing us the distribution of performance by chronic condition of the population. So the way that this report will be used, or the way this visualization will be used, is it's for everybody who is eligible for the AMR measure. So everybody within the age range of 5 to 64 years old with persistent asthma, but it's looking at what additional chronic conditions those beneficiaries have. And this is a good way to identify if there are any gaps or if there's any subpopulations that are persistently having a harder time meeting those measures. Again, that could be a helpful data point for care managers or others. Towards the bottom, we are showing our population by race and by age and by gender. and this is the performance of the measures for each of those demographic categories. So for example, among the white population, 97%, they have 97% performance, so 97% of the beneficiaries have that AMR of greater than 0.5. And all of these charts do have beneficiary details where you can get back to your population navigator view and drill down further for additional clinical or other demographic characteristics. And likewise, on the right side, we show the age and gender distribution as well. So back to our landing page. All of the rate-based beneficiary level measures do have the same flow. They do have the same structure. I do want to highlight something unique about the controlling high blood pressure and the HbA1c measure. According to the specifications, those beneficiaries that do not have the specific coding to identify high blood pressure or to identify or any blood pressure reading or to identify the HbA1c for that patient is classified as missing. According to the specifications, any beneficiary with a missing value is considered non-compliant with the measure or not meeting that performance or not meeting that measure in terms of the performance calculation. So we do have for those two measures an additional column to identify the population that is missing the input. They are missing the coding required for them to determine if they have that, if they've met that measure. You will see that the performance rates are a little bit less favorable for these because of the high prevalence of the missing values. So what's important here is that we are able to look at this view two different ways. You're able to look at the distribution of those patients for this measure that have high blood pressure or blood pressure less than 140 over 90, the population that has greater than 140 over 90, but you're also able to identify the population that does not have a blood pressure reading and has been identified as missing. So this is actually very actionable in that that care managers and others are able to follow up with the population who is missing to be able to kind of convert those and to make sure that billing gets into the claim so that they are able to have their blood pressure captured here. You are able to toggle off of this. If you would like to exclude those with the missing, you can just switch this to yes. The missing column is going to go away and your numbers are going to readjust just to make sure that you're only capturing those with missing. And the rest of this report mirrors that of the AMR and that you have the details by race and you have details by age and gender. Now, as we look into our rate-based event measures, I'm going to focus on the mental illness. Actually, before we jump into that, just a quick snapshot that these first three measures here are not going to have beneficiary drill throughs because they are 42 CFR sensitive conditions. So we're looking at emergency department visits for alcohol and other drug abuse or dependence. And we're focusing on those topics across these reports. So we do have a report structure, so you're able to see your overall performance and your trend in your utilization, but do not provide the beneficiary drill through information for 42 CFR privacy concerns. So for this specific report, we're looking at 30-day follow-up after hospitalization for mental illness. You do have your overall bar chart on the right side. This is showing your performance, both the number of beneficiaries that meet the measure that are included in the numerator, as well as the overall eligible population or your denominator. As I mentioned at the beginning, we do have a service date slider for these event-based measures. So you're able to customize this view for any date range of interest to you. Since we are looking at individual events, this is now a line chart where you're able to see your trend over time. So this is capturing the events for each individual month and what percent of those events did have the appropriate follow-up. Blue line is reflecting your panel, and orange line is going to be reflecting your comparison group. In my example, we're looking at the Medicaid population. The bottom of the report focuses on the primary diagnosis for those emergency department visits, as well as the distribution by age and by gender. All right. I do want to highlight one thing about the event-based measures for the prenatal and postpartum care. We do have two measures here that are related to maternal health. The format of these are very similar in that, except for we provide separate information about place of birth when you're looking at postpartum or prenatal care, and we just have the distribution by age here. One other unique function of these reports is that you are able to navigate yourself directly into the maternal health dashboard, which is located on the left menu here. So if you navigate through the quality dashboard and are interested in the prenatal and postpartum care and want to get more information about those types of services, you can navigate directly from the top to the maternal health dashboard here. All right, so now in our last type of measures, we have our count-based measures. As I mentioned earlier, these are simply counts of events. We do not provide any comparison group details as it would not be an apples to apples comparison. So these are simply just factual counts of services based on the measure specs. I will focus on admissions to an institution from the community. All of the count-based measures do have the same form and function, so you will find the same visualizations in each of those reports. Again, we do have a date slider at the top so you can customize your view. You will see that you do not have any, as I mentioned, you don't have that comparison group, you don't have those orange lines. Also, on the right side, we do provide the 4 most recent calendar years, and this is looking at the count of those utilizations for those calendar years. And you can get the beneficiary details for each of those 320 institution visits that have happened in calendar year 2024 for this population. You can get to the beneficiary details as I showed you earlier, filter your population as needed, and then create rosters if that's of interest to you. So in addition to the trend lines, in addition to the overall performance, the bottom visualizations are showing you distribution by hospital. So you can see where those admissions are happening. You can also look at the top diagnoses. So these are primary diagnoses ranked in order to understand what's causing those admissions. And at the bottom, we're looking at count of institution visits per beneficiary. So this is effectively saying how many institution visits are appearing per beneficiary. So for example, we have 20 beneficiaries that have each had 8 institution visits in this time frame I'm looking at, which is almost 3 years. If you do click into the chart area, you can click and drag and select more than one population at a time and be able to access the beneficiary details for that combined population. So I've highlighted everybody, all the beneficiaries that have had up to 12 institution visits. I've captured that whole area and I can look at the beneficiary details for that whole population. That functionality does exist in all of the charts. So if you want to look at more than one age or more than one race category, excuse me, more than one gender, more than one age category, you're able to do that. Okay, that's a quick walkthrough of the individual reports. I do have one more report that I want to show you, which is the Health Equity by Demographics Quality Report. You can access that report either from your left menu, or you can access it from the button on the top of the quality measure dashboard. So this report functions very similarly to how the Health Equity by Demographics report in the base reporting suite functions. We are focusing on reporting the performance of each measure, but enabling the user to also look at different clinical and demographic characteristics. So given that our measures are working on different dimensions, so we have our beneficiary rate based, we have our event rate based, and we have our counts, the visualization differs slightly, but it's giving you the same information in just a different view. So we have all of our quality measures listed on the right side. Every one of the quality measures from our dashboard is represented here. The first five are our rate-based beneficiaries, the next five are our rate-based events, and then our last four are our count-based. So I'm right now looking at our asthma medication ratio, and I'm showing it by age group. And this is showing me the asthma medication ratio for each age group. So again, the threshold for meeting the measure is 0.5. And this is showing me that across all of my 61 to 64-year-olds, the asthma medication ratio on average is 0.78. And that is slightly lower than our less than 18 that has an AMR of 0.98. So by using this report, you're able to toggle on different dimensions. You're able to look at your age, your gender, your race, your county, your region, or your dual status. And it is just arraying for you what the AMR is for that specific demographic population. If at any time you want to exclude any category, if, for example, I'm not interested in looking at my less than 18 or my pediatric population, I can toggle that off and it will update the report for me accordingly. You also have the opportunity to add separate charts, just like you do in our other base report, where if I was interested in looking at age group and by gender, you can add the gender line, and this will create three different charts. We have the age by female, the age by male, and we do have some unknown genders in our demo set. So as we move down the report, we have our disparity index. And our disparity index is effectively looking at the difference in the performance in each of our demographic populations relative to a base population. When we're looking at our ages, our base population is the 61 to 64 population. And you'll see that their disparity index is a 1.0. Effectively, it is their measure rate. It's the measure rate divided by the base population. So the base will always have a disparity index of 1.0. In this situation, a higher disparity index is actually favorable because the measure is indicating that you want to have a high AMR. So we can see that our less than 18 population has the highest disparity index. It's 0.98 divided by the 0.78 produces a disparity index of 0.26. But as you use this report going across your measures, your disparity index will be a good indicator if there is potential health equity issues or potential access issues. So if there are certain populations that are meeting the measure at a different rate or having a more difficult time meeting the measure, you're able to see that more clearly here. The bottom of a report is showing the population by chronic condition. So we are showing it by chronic condition as well as by age, and this is giving me the count um, for the count of beneficiaries in each of one of those cells. So we're looking at everybody from the AMR perspective and looking at them across by age as well. So just it's an interesting way to look at the population and see what the distribution is, and the distribution is by chronic condition and what their associated AMR is. And again, you're able to access beneficiary details if you're interested in any specific cell or intersection of this table. All right, I think at that point, that wraps up our demonstration for today. If you have any questions about this report or need any technical assistance, please feel free to reach out to report-support@crisphealth.org, and we'd be happy to help you. Thank you so much.